On the court, Kudun Brogan is still honing her skills. But off it, she's had to master the complex systems managing her health.
So we went to the doctors and the doctor says I have the diabetes and I was scared.
The 6-year-old was living in the remote Arnhem Land community of Gumbalanya when she was diagnosed with type 2 diabetes last year. Before that, there was no sign she was sick.
We went into the clinic and just did a blood test and they just said do further tests and came back confirmed she does have diabetes.
Worryingly, Kudun's far from alone. New research analysing data from public health clinics has revealed 1 in 150 young people across Northern Australia are affected by type 2 diabetes. That's 10 times higher than previously reported.
And the highest rates were in Central Australia, where it was 1 in 70 young people, and in young women's, kind of 15 to 24-year-old women in Central Australia, it was 1 in 35 of those young women were affected by type 2 diabetes.
Researchers say the issue needs to be treated and funded like the crisis that it is.
This is a preventable disease. So yes, we have really high rates, but it's a call to action that we could change this. If we don't change it, there are big implications for future complications.
Our government is spending an enormous amount of money on what we call the complications of diabetes, which is the far end being the heart attacks and the kidney dialysis and amputations. Whereas investment in preventing diabetes and in managing diabetes will ultimately save money.
They're shocking statistics that Kudun's mum believes would spark urgent action from all levels of government if it were reported in a different cohort.
If this same type 2 research was done in urban, it would be a big campaign drive. Because it's Indigenous, it's kind of pushed to the side, put to the spotlight for a few seconds and then not to be seen again.
4 generations of the Brogan family are affected by the disease, including Kudun's grandmother Vicky and mother Gemma.
It's just something that we live with every day, and I know it's hard sometimes, but at the end of the day, it is a disease, and it's a silent disease.
Kudun Brogan has now been diagnosed with both type 1 and type 2 diabetes and is managing some very grown-up routines.
I take my needle every day and bring it to school. Then I get my needle in my belly, then I get medicine.
The strong message to young people is get tested early.